My name is Dr. Gary Lopaschuk. I'm a distinguished university professor in the Department of Pediatrics in the Faculty of Medicine Dentistry at the University of Alberta. My research is primarily in the area of cardiac energy metabolism and the regulation of the pathways that control energy use in the heart. I'm interested not only in how the heart normally uses energy, but what goes wrong with energy metabolism in the setting of heart attacks or heart failure. Why I'm excited about this research is because the heart has the highest energy metabolic needs of any organ in the body, and you could predict that because it's pumping all the time. So the heart has to produce a huge amount of energy in the form of adenosine triphosphate to sustain contractile function. And of course, if you didn't meet those energy demands, the heart would stop, and that's not compatible with life. And interestingly, the heart doesn't have any energy reserves. If the heart stopped producing energy, you'd only have enough ATP for about 6 beats and the heart would stop. So through your entire life, through every kind of stress, any kind of pathological situation, any kind of nutritional state, the heart has to continue to produce a huge amount of energy. And we're very interested in what these pathways are and how they're regulated. We focused most of my research career, we focused on the control of the main fuel of the heart, and that's fatty acid oxidation. Because fatty acids are a plentiful source of fuel for the heart, and so the heart has evolved to using primarily fats as its fuel source, and that ensures that because we have plentiful fat supplies in the body, it ensures that our heart has a plentiful supply of fatty acids in times of demand. Unfortunately, in times of stress, and that can be a heart attack, it can be heart failure, it can be in diabetics or obese individuals, the heart starts using too much fat. And it does so at the expense of carbohydrates. And so that carbohydrates, which is the second most prevalent fuel used by the heart, is shut off in these different disease states. And this actually is detrimental to the heart. And our research is primarily on just trying to understand how fatty acid oxidation and metabolism is regulated in the heart, what goes wrong in different disease states, but just as importantly is how can you reverse this and increase carbohydrate use and get back to normal, particularly in a setting of heart failure or a heart attack. So I was asked to just give you some advice about what the students and community interested in or passionate about with cardiovascular health and research. Well, I think this is an area that one should be passionate about because cardiovascular complications, that's heart and stroke disease, is the major killer in the world of individuals, and it's a major source of morbidity. Heart failure is not a fun disease to have. It is really, first of all, it has a high mortality, but heart failure has a very poor outcome, and you have no exercise tolerance, you're congested. It's not a disease people want to live with. And I think one should be excited and interested in trying to either prevent the development of heart failure as well as treating heart failure. And we actually made great strides, not myself personally, but the scientific community has made great strides in trying to prevent heart failure by having a healthy lifestyle. And I'm not going to, talk about all of the things one should do to treat cardiovascular health, but we know about physical activity and lowering your cholesterol, not smoking, not trying to maintain a low body weight. All of these things can lessen the likelihood of developing cardiovascular disease. But I think it's also exciting, and what I'm passionate about, is trying to actually treat these diseases by improving energy metabolism. And I think there's a lot of potential for that And it would be exciting to see a lot of students getting turned on by research and exploring these particular areas. And so I think I've had a very um, satisfying career, and it's been very exciting in doing in research and trying to understand some of the intricacies of how the heart functions, how the heart uses energy. And I think I would highly encourage individuals to consider research as a potential career option, because it is really exciting and hopefully can also contribute to the health of the cardiovascular health of Canadians and people worldwide. So with that, I'll stop. Thank you very much.